Ebola and Marburg are related viruses that cause hemorrhagic fevers. Both of these lethal viruses have haunting effects and often result in death. However, there are several ways to prevent these viruses from spreading, and several methods of treatment are currently being researched. The viruses can be transmitted to humans by being exposed to an infected animal's bodily fluids. For example, eating infected animals can spread the viruses. Scientists who have operated on infected animals have also contracted the virus.
Infected people typically don't become contagious until they develop symptoms. Family members are often infected when caring for sick relatives or preparing the dead for burial.
One method of prevention includes wearing protective clothing such as masks, gloves, gowns, and goggles while around infected patients. This is in order to prevent coming in contact with any blood or other body fluids of the patient. Complete sterilization of needles and equipment is necessary to prevent the viruses from spreading.
Whenever possible, the patient should be isolated to avoid coming in contact with unprotected people.
Even after an infected person dies, it is important to avoid direct contact with the body of the deceased patient because the virus is still able to be passed on.
Scientists are working on a variety of vaccines to protect people from Ebola or Marburg viruses. Some results have been promising, but none have been approved and are still undergoing further research. A controversial treatment of Marburg virus is the use of heparin, which prevents blood clotting. It is still in the testing stages and has not yet been approved for use.
Ribavirin is an antiviral drug previously used to treat other types of viral hemorrhagic fevers. However, it has not shown to be effective for treating Ebola-infected patients.
Because there are no approved or effective vaccines, several other methods of treatment are used. Although they are not always successful, both Ebola and Marburg patients receive supportive therapy, including balancing the patient's fluids and electrolytes and maintaining their oxygen status and blood pressure. Until vaccinations have been tested and approved, people must stay educated in order to be informed about how to deal with and prevent the spread of Ebola and Marburg.
When it's classic Ebola and it's 75 or 90% mortality rate and bleeding symptoms, I think people can see that that's beyond the baseline of mortality right away.
The whole point about Marburg and Ebola is that when there is an epidemic, it's such an acute thing that people are dying in front of your eyes, and selectively in many of these outbreaks it's been medical people, doctors and nurses, and these have been in very remote and forlorn areas where it's difficult to keep those people there anyway, and now suddenly they're dying out.